Improving and better engaging millennial students through simulation. Hello, my name is Sheila Searles, and I am a digital product educator with Elsevier. In this session, I will discuss the characteristics of the millennial learner, engaging millennial students through the use of simulations, simulation best practices, and a document that is downloadable will be provided for integrating simulations into your curriculum. The term millennial generally refers to the generation of people born between the early 1980s and 1990s. This generation is also known as Generation Y due to the defining cultural events such as the internet, 9/11, communication devices, smartphones, computers, laptops, iPads, iPods, and movements such as the lesbian, gay, bisexual, and transgender rights have all helped to form this generation. While we want to be cautious not to overgeneralize, students being aware of the general characteristics helps educators to create a relevant and appealing learning environment for this generation. Some of the common characteristics are as listed here. Frequent contact with their social network. They're accustomed to learning in groups and with the help of technology, so they are techno-savvy, needy for feedback, especially immediate feedback, collaborative, optimistic, hopeful, confident, goal and achievement oriented and inclusive, and of course they have shorter attention span. The learning preferences of millennials are simulation, interactive groups, workshops, game-style presentations, e-learning such as podcasts, educational websites, virtual patient simulations, interactive multimedia tutorials, and active learning in the classroom. Millennials flourish when these are incorporated into their lesson plan. Now let's talk about the use of simulation. Simulation helps the learner to transfer basic knowledge into care. It creates interactive hands-on learning, situational learning, and clinical experiences not available in the clinical setting. So it's more intentional than sending the student off to clinical. When they're at clinical, no two students have the same exact experience. Use of simulation helps to create that type of similar experience for each student. Simulation uses. Simulation is used to teach skills, practice skills, and evaluate skills. When discussing skills here, I'm not only referring to technical skills such as IV insertion, dressing changes, medication administration, etc., but also to skills such as compassion, communication, critical thinking, attention to detail, recognition of change in the patient's status, confidence, delegation, prioritization, patient education, safety, teamwork, collaboration, and many more. As noted previously, the typical millennial learner appreciates hands-on and collaborative learning environment. They do well when guided. So engaging the learner through the use of simulation, consider breaking down the didactic, clinical, and lab silos, introduce a concept or topic through simulation, role model expected performances. Millennials really like to be guided, and they appreciate a role model and being shown what to do so that when put into a given circumstance, they will then know what to do. They appreciate when you provide supportive feedback, allow students to repeat performance, incorporating the feedback, and use helpful communication tools such as SBAR. Simulation brings content to life. According to the International Nurses Association for Clinical Simulation and Learning, in AXL, there are a set standard of practice for simulation. These standards are developed in collaboration with the NCSBN, the National Council for State Boards of Nursing, and they've incorporated the findings from their national simulation study that was released in the fall of 2014. The standards of best practice in simulation include simulation design, outcomes and objectives, facilitation, debriefing, participant evaluation, simulation enhanced IPE, and operations. So let's start with simulation design. When formulating and designing a simulation scenario, perform a needs assessment. What are the needs of my learners? Where are those learning gaps? Where are they struggling with transferring the knowledge from the classroom into the practice arena? Construct measurable outcomes, structure and the format based on the purpose, theory, and modality for the simulation. Design a scenario case to provide context. This helps the information to come to life. Use a variety of fidelity, using either case study, a low fidelity, mannequin, high fidelity, or even a standardized patient, depending on the scenario and what it is that you're trying to achieve. Maintain a facilitative approach that is participant-centered and driven by the objectives. Participants' knowledge, experience level, and expected outcomes. So all of these should be taken into consideration when facilitating. Begin with a briefing followed by a debriefing, evaluation of participants. Facilitators should also have the evaluation, the 360 evaluation. Evaluate the experience, the facility, and the support team. Provide preparation materials and resources, and pilot test a simulation before full implementation. This is taken from the INAXL standards of best practice in simulation found on their website. Please feel free to go to their website for further detail discussing simulation design. Outcomes and objectives, another standard. Determine the expected outcomes for simulation-based activities and/or programs. Construct specific, measurable, achievable, realistic, time-phased objectives or SMART objectives based on the expected outcomes. When facilitating these simulation scenarios, it is imperative that you keep always in your mind the expected outcomes and objectives for that simulation scenario. Any faculty or staff involved in simulation facilitation must have the teaching knowledge and skills in simulation. Simulation is to be a safe environment for student learning and evaluation. Institutions should consider recommendations for certification in healthcare simulations as offered by the Society for Simulation in Healthcare or Drexel University, just to name a few. The facilitator needs a specific skill set and knowledge in the simulation pedagogy. The approach is appropriate to the level of the learner experience and competency. Level 1 or beginning student simulation approach would be different from that of a student ready to graduate from the program. The student, by the time they get to graduation, the expectation would be that they would be performing more on their own, whereas with the level 1 or the new learner, we would want to help guide them as a facilitator and actually perhaps even perform simulation for them to teach them what is expected. Preparatory activities and pre-briefing to prepare participants as part of facilitation. The facilitator would supply cues aimed to assist participant in achieving expected outcomes, support participants in achieving expected outcomes. Again, there's more information on this in the Anaxel Standards Best Practice found on their website. Debriefing is also a part of simulation and best practices. It is often said that debriefing is where the student does the most learning. There's a lot of reflection in debriefing. Therefore, it's important for the facilitator to be competent in the debriefing process. The environment is to be conducive to learning and supports confidentiality, trust, open communication, self-analysis, feedback, and reflection. Must devote attention during simulation to debrief effectively. If you are the one facilitating the debriefing, you must also be very astute when facilitating the simulation activity itself. Therefore, able to then correctly and effectively debrief. The use of a theoretical framework for debriefing that is structured in a purposeful way. Debrief is congruent with the objectives and outcomes of the simulation-based experience. Evaluation. Determine the method of participant evaluation prior to the experience. Usually this is directed by the objectives, outcomes, and/or the intent of the simulation. The method is guided by the type of evaluation. Is the evaluation formative, where you're going to provide ongoing formative feedback, support participants' clinical competencies, identify and close gaps in knowledge and skills, assess readiness for real-world experiences, facilitate teaching and learning. This type of evaluation works very well for the millennial learner. This allows them to feel supported while providing instruction and evaluating. This does require a formally trained facilitator. Use small group ratios of 3 to 5 students to facilitator. When you're looking at summative evaluation, usually performed at a certain point in a semester or at the end of a course program, you must use a valid and reliable instrument. Training must be provided to the rater for norming. Participants are to be informed of the evaluation process in advance, and feedback to participants. Now, when you're talking about high stakes evaluation, this type of evaluation usually occurs at the end of a course or program, and it may occur other times to assess gaps in knowledge or safety issues or concerns, and after multiple exposures to simulation. Based on specific objectives, consequences, and outcomes explained to participants, simulation experience must be piloted and tested prior to using. Use a validated evaluation tool that is comprehensive, such as a checklist or a rubric, that clearly outlines the desirable and undesirable behaviors. More than one evaluator for participant is a must. Professional integrity. So, as a facilitator, you want to foster and role model attributes of professional integrity at all times. Follow standards of practice, guidelines, principles, and ethics of one's profession. Create and maintain a safe learning environment, and require confidentiality of the performances and scenario content based on the institution policy and procedures. Enhanced interprofessional education. This is becoming more prevalent, and it is based on a theoretical or conceptual framework. It requires utilize best practice in the design and development of IPE simulation, recognize and address potential barriers, and devise an appropriate evaluation tool. And lastly, operations. There are certain criteria that should be incorporated when looking at the operations of a simulation center. Implement a strategic plan, provide appropriate training and expertise to all those who are to participate in facilitating any type of simulation. Use a system to manage space, equipment, and personnel resources. Maintain and manage financial resources. Use a formal process for effective systems integration, and create policies and procedures. All of this can be found in greater detail on the INAXL website. Please feel free to explore this website more, and hopefully it'll help you to meet your needs in your simulation as you move forward with integrating simulation into your program.